How to use health insurance when visiting a doctor or in an emergency. Understanding how to properly use your health insurance when visiting a doctor or facing an emergency is crucial for anyone living in the United States, especially newcomers, international students, or immigrant workers. The U.S. healthcare system is known for complexity and high costs, so knowing how to navigate insurance procedures can save you money and help you avoid unnecessary complications. When you feel unwell or need a routine checkup, the first step is to determine whether the doctor or medical facility you plan to visit is within your insurance network. This is essential because using out-of-network services usually means significantly higher costs and may even result in your insurance not covering any expenses. Most major insurance companies provide online provider directories or customer service lines where you can confirm if a provider is in-network. When arriving at the medical facility, you should bring your health insurance card, typically issued by your insurer after enrollment. This card includes key details such as the name of your insurance provider, personal ID number, group number, if applicable, customer service contact, and your cost-sharing terms like copays, flat fees for each service, deductibles, the amount you pay before insurance kicks in, and co-insurance, a percentage of the bill you're responsible for. At the front desk, staff will ask to see your insurance card and a photo ID to verify your information. Depending on your plan, you may be required to pay a copay up front. For example, $25 to $50 for a primary care visit. In emergency situations such as car accidents, severe chest pain, difficulty breathing, unconsciousness, heavy bleeding, or major trauma, you should call 911 to be transported to the nearest emergency room. Under federal law, EMDLA, hospitals are required to treat anyone experiencing a medical emergency, regardless of their insurance status. However, after stabilizing your condition, if the facility is out of network or you are uninsured, you may be left with a substantial bill. Some insurance plans cover emergency services at any hospital, regardless of network, but you should review your specific policy for details. After treatment, the hospital will send a medical bill to your insurance company. The insurer will review the services provided and pay their share based on your plan. The remaining balance, such as copays, co-insurance, or charges above the coverage limit, will be sent to you via mail. You should compare this bill with the explanation of benefits, EOB, provided by your insurer to confirm that the charges are accurate. If you receive an unexpectedly high bill, it is worth calling the insurance company or hospital billing department to dispute or negotiate the charges. For those enrolled in a high-deductible health plan, HDHP, you must pay out of pocket for most medical services until you meet your annual deductible, which can be several $1,000s. However, you can use a health savings account, HSA, to cover these expenses with tax advantages. If you have an HMO, health maintenance organization, plan, you usually need a referral from your primary care physician, PCP, before seeing a specialist, except in emergencies. With a PPO, Preferred Provider Organization, plan, you have more flexibility to see specialists without referrals, but costs may vary depending on whether the provider is in-network. It's important to note that not all healthcare services are covered by insurance. Vision, dental, mental health counseling, or prescription drugs may not be included in your basic plan. Always check your plan documents or contact your insurance company to verify coverage before receiving services. Additionally, some treatments such as MRIs, CT scans, or surgeries may require pre-authorization from your insurer. Without this, your insurance may deny the claim entirely. Managing your health insurance effectively means staying organized with your medical records, bills, and benefits. Most insurers offer online portals or mobile apps where you can check your deductible balance, remaining visit limits, billing status, and in-network provider directories. You can also set alerts and reminders to avoid missing open enrollment periods or policy renewals. In summary, using health insurance in the U.S. requires a clear understanding of your plan's terms, conditions, and benefit limits. For regular doctor visits, always choose in-network providers and carry your insurance card. In emergencies, prioritize your safety, but follow up with your insurer and provider to resolve billing. Knowing how to use your health insurance properly not only helps you avoid unnecessary expenses, but also empowers you to maintain long-term health coverage with confidence and control.